last decade, we have seen a gradual increase in patients who present to you with pimples for the first time after 25 years. And since they are no longer teenagers, it is more uncomfortable for the patient. Challenge for your doctor is that your skin is not as oily as a 19-20-year-old would have with pimples. One thing is very important for the viewers, that one should not use soap on the face. If you're a patient who has a combination to slightly oily skin, then one can opt for face washes which have 2% glycolic acid. There are molecules which are like mandelic acid, which is very good for sensitive skin with acne. There's also there are a lot of studies which say that if your cortisol is on the rise, it will also reduce the hair cycle, right?
Mm-hmm.
So it all boils down to metabolism and nutrition. There are certain things in a hair color known as PPD, paraphenyl diamine, which we generally tell to avoid. Use good products for your scalp cleansing. Always use anti-dandruff shampoo at least once a week. Keep your scalp health good, and make sure you condition your hair and you oil your hair. For skin, never skip a sunscreen, never over exfoliate, never overwash.
Hello and welcome to another episode of Health for You. I'm your host Chetana Belagere, and today we are diving into some of the biggest concerns most of us face: hair fall, acne, sweat boils, other skin issues, baldness, and even some of our silliest makeup mistakes which we probably do. Whether we should do facials, we should not do, should we oil our hair? There are a lot of things that keep coming to us, right? I mean, every single day, I'm sure all of us have these questions in our mind. So today, joining with me is one of Bengaluru's top dermatologist and hair expert. She's a gold medalist in MD dermatology, and she's the founder of Dr. Divya Sharma Skin and Hair Solutions at Whitefield. Dr. Divya is here to bust myths, simplify skincare and hair care for us. Thank you very much for joining this show, ma'am.
Thank you, Chetna ji. Thank you for having me over. And it's always fun conversing with you.
Thank you,
You
ma'am.
know,
My pleasure. Thank you so much. Ma'am, before I start my show, I usually ask my guests, what would you have been if not a doctor today?
Actually, Chetna ji, that's a hard question to answer. But possibly, I feel as our generation was like, we are 80s kids, and you had to particularly do science, perhaps, but there's only one profession in this world where you get to practice kindness every day. So I think that is where medicine has no alternative. But yes, I do see myself as a teacher, if
Okay.
not a doctor,
Wow.
right?
Yes.
So
Again,
I
service.
think,
Again.
yes, but then teaching keeps us young, isn't it? I'm sure when you read for your podcasts and columns, it's so much learning, even in your profession. It's
Absolutely.
like every day. And I really appreciate, Chitna, you're always ahead of others when it comes to picking up the news feed. And, so many times we have conversed when you said, doctor, this is buzzing. What is it about? So learning is a never ending process.
Thank you so much. Thank you for your kind words. Thank you very much, ma'am. Diving straight into today's topic of discussion, doctor. I think it's better to split it into skincare and hair care separate, because there's so many things. I'm sure this time would not be like sufficient for us to cover everything, but maybe we'll talk about some things. There are many emails that come to me on weekly basis and saying, why don't you bring this person, this doctor, these questions answered. So I get a lot of questions on hair care and skincare, especially with a lot of things happening in India with related to hair fall and baldness. There have been issues going on in Maharashtra and all of these things. So it's better to split the two, is what I thought. And coming to skincare first, first of all, could you tell us if there are actually different skin types? Because I whenever I visit a dermatologist, I am asked this question of is your skin oily, is your skin dry? I don't know how to actually identify. Many people do not know. Probably now, I mean, we all look at. So, is there,
Yes.
first of all, different skin types, and then how do we identify it?
I mean, you've asked a very pertinent question. Chetna ji, you're very right. Many a times people ask, doctor, before you ask me, I want to ask you how's my skin type, right? That's exactly what you said. So, honestly speaking, dermatology doesn't distinguish people in 4 or 5 skin types the
Okay.
way you hear it on social media. But for the sake of simplicity, we sometimes refer patient as normal skin, oily skin, combination skin, dry skin.
Okay.
Uh, One thing that our viewers should know, that skin is a very dynamic organ. You don't have a permanent type. It can change according to your internal changes as well.
Hmm.
But the way to identify for a layman is to tell, how do you feel? If you haven't put a night cream, how do you feel when you get up in the morning? That is the best time to identify your skin type. So if you feel when you get up in the morning and your face is very oily, there's a lot of oil that you feel, it's probably oily. If you feel normal, that's normal. But I also feel, Chetnaji, that there are certain areas of your face which are actually desert zones, which will never be oily. One
Okay.
of them is your under eye and around your mouth.
Hmm.
So, from a dermatologic point of view, we know every patient is a combination. Even the oiliest of skin cannot have oil under the eye, right? So, for the sake of simplicity, just see and identify your zones when you get up in the morning. Make sure you haven't applied your night cream a day before,
Okay.
right? Most of us would fall in combination category, or normal skin, or people with oily skin. Dry skin on the face would be that if you see dry patches. As a doctor, I know if my patient is feeling dry on the face, something is not okay. On
Hmm.
the face, dryness is never normal. You know,
Okay.
I feel it is a sign of some predisposition or condition.
Hmm. Hmm.
But to make it simple, get up in the morning and see in the mirror, how do you feel? And that would almost say, to a great extent, identify your type.
Okay. So once coming to this thing about what are some of the, I mean, whatever I've been hearing, I've been seeing, there've been a lot of discussion happening on X and other platforms. You are very active on X. So, especially now being summer. So, but what are the kind of common skin problems that you are seeing in your clinic these days?
Summers, as we all know, will bring a lot of things like what you call as heat boils, or people call it as, a lot of folliculitis on the back, especially in areas, we Bangaloreans are really lucky and blessed to be in a city where even when the entire country is scorching heat, we are blessed to be here. But for
Yeah.
most of the India is a tropical country, so they do get boils on the back, heat boils on the body.
Mm,
Then a lot of because of increase in humidity, there is also a little bit more exacerbation of acne in especially forehead. Then scalp issues also.
mm,
Scalp itching also increases in certain people in sweating in the times of the year when it's more sweaty. So these are the common issues we get, and a lot of itching on the back and chest. Lot of seborrheic dermatitis. Ironically, in winters generally we get seborrheic dermatitis, but also in the heat,
mm,
right? So
mm,
at hot temperatures, people do have problems related to scalp, face, and back acne. The infections are on a rise, especially fungal infections,
mm.
because of humidity, especially in the folds like the groin area, the underarms, and under the breast in women. So fungal infections also are on the rise during summers.
Okay. Ma'am, having said this, you spoke about boils. So how do I differentiate between acne and boils? Because normally what happens, even for children for that matter. So, of course, it's a different category per se, but then, how do you actually differentiate between the two?
Chitnaji, very good question, because acne is inflammation of oil gland. And one must know that oil glands are present only on the face, your head, and your back, and little bit on the upper chest area. So when you see pimple like things or boil like things in these zones, we call them as acne. On arms, legs, buttocks, abdomen, thighs, that is boil or furuncle or folliculitis. That is infectious, or very rarely due to some heat boils, or milia occlusion of sweat glands. But acne is inflammation in face, head, chest, upper chest and back.
Mhm.
Other areas, it's all a boil.
Okay,
Right.
okay, okay. So, many these days there is an increase. What people come up with is, they have questions on, there is an increase in adult acne, because normally what happens is acne is considered as, a teenage issue, or, issue when you are just hitting the menarche and things like that, puberty and all that. So, are you actually seeing an increase in adult acne, and why is it happening?
Honestly, Chetnaji, there's a pandemic of adult acne, if you ask me. When we were studying, we would tell patients, treat your acne well so that you don't scar. And anyway, it will go after 23, 24. But I'm talking of India of early 2000s, right? Now, with the rise in obesity in women and men alike, there was also a time in this country where women were not as obese as men, right? Now,
Right.
since we work with men, you do see an increase in sitting hours, and there's a lot of abdominal obesity in female patients. So, post COVID, also, there has been a rise, but I would say last decade, we have seen a gradual increase in patients who present to you with pimples for the first time after 25 years. And since they are no longer teenagers, it is more uncomfortable for the patient. Challenge for your doctor is that your skin is not as oily as a 19-20-year-old would have with pimples, while the products that you use for acne are drying in nature.
Mm.
So patients are often confused. The doctor, I never had pimples when I was younger. I have pimples now, and I don't really have a very oily skin also.
Mm.
So, Chetna ji, there's always been a lot of talk about that how only oily skin gets acne. I feel it's a false information to the patient. Acne is an inflammation of oil gland, and it can happen to patients who really don't feel too much oil as well,
Oh, okay. Mm-hmm.
especially adult acne. So not everyone has to pick up a salicylic acid on the shelf and apply. And what happens is, if you look at nowadays, you don't follow social media also follows you.
Right. Very
So a
true.
lot of advertisements pop out, and then you
Yes.
feel I'm looking for acne, and doctor, I just randomly started using salicylic acid, but I somehow feel I'm itching after that. So,
Mm.
inflamed oil glands can be found in any skin type. Adult acne is more painful, leaves behind red marks, which take a bit longer than a teenage acne to go.
Mm. Mm.
Challenge is that you're more uncomfortable because you feel at 35, 40, it doesn't look good, doctor.
Yes.
I'm with a lot. And so, those are few challenges, but there's definitely a surge of adult acne, I would say.
Why is that so, man?
As I said, obesity, PCOD in women. And why forget men? Men don't have ovaries. We don't, sort of classify them as PCOD. But you do see a lot of young men with fatty livers
Mm.
and lot of junk food. The food we have grown up in a country where outside food was a luxury. It's no longer a luxury. Everybody from tier one, two, three, four cities, everybody eats out. And increase in saturated fats, increase in carb, lot of refined flour we eat. We eat out much more than our parents,
Mm.
right? We are exercising less, we are eating more. That is the reason that the entire scenario, I mean, the adult acne has picked up so fast.
Okay. So is there I mean, it can be treated with local medicines, or is it again, your your entire lifestyle change is what you usually advise? I mean, does that go hand in hand? How does it work?
One must understand that topical medications prevent scarring.
Okay.
The deadliest scare I have with acne, scars. And no matter how many lasers you do, you can never make them 100% better. So one has to treat pimples on time to prevent the scarring. But vis-a-vis, without a lifestyle change, it is very difficult to bring it under control because the real cause is sometimes not on the skin.
Correct. Yeah, absolutely. Ma'am, heading straight to some of these common questions that I'm asked, like, everyday skincare routine for somebody who has a normal to slightly sensitive skin. I know it is very difficult to probably generalize and give that, to do things, but is it possible to have like a basic everyday skincare routine? If yes, what?
Absolutely. Absolutely. I mean, every human being deserves a skin care routine, and skin deserves a skin care routine because that's a right. It's an ornament in which one has to invest. So one thing is very important for the viewers, that one should not use soap on the face whatsoever. Even if you have the oiliest skin on the planet, you feel soaps give you a temporary feeling that my face looks oil free, but skin has a very delicate pH balance, so always use a cleanser. If you are a patient who person who feels that my skin is normal to sensitive and I get redness and itching very fast, avoid using face washes containing salicylic acid and glycolic acid. Go for something very non-soapy cleansers. Non-soapy cleansers which contains sterile alcohol. Now, they don't have alcohol which causes tinging, right? So sterile alcohol is very, very mild. So you go for cleanser which doesn't foam. If you're a patient who has a combination to slightly oily skin, then one can opt for face washes which have 2% glycolic acid. There are molecules which are like mandelic acid, which is very good for sensitive skin with acne, right? So, and then there are some cleansers which come with little exfoliating beads. I only suggest adults to use them. So always have a cleanser and never use a soap. Never be very harsh in washing your soap. We being Indians, we like to keep things clean,
Mm.
right? I don't know about the rest of the world, but I do feel we have a fetish for keeping face clean, kitchen
Right.
clean, house clean. So cleanse it, but don't overdo it, right? I'm not in favor of double cleansers also. Honestly speaking, my personal view is that when your face has oil glands, it doesn't need a oil to cleanse.
Mm.
So, my opinion is a big no for double cleansing, right? Use a micellar water for cleaning your makeup, right? Never use a soap or a harsh cleanser. A
Mm.
cleanser must wait for a couple of minutes after washing face, because what happens when you wash face, all of us feel dry. That's not the right time to put a moisturizer. Wait for 5 7 minutes and see. Most of the skin, especially people with oily skin, most of the areas will get oil. So where you feel more dry, you can put a moisturizer. Now, moisturizer, if you are a dry skin, you can go for moisturizers containing hyaluronic acid or ceramides. But if you have a oily skin, we do get oil control moisturizers, which give you a little mattified look. One can go for that. But if you're in a very humid environment, say I'm living in Chennai summers or Vizag summers, I can even skip a moisturizer, especially men.
Mhm.
I have practical advices that don't listen to influencers who say, yeah, everybody needs a moisturizer, but when you're at 45, 50 degrees Celsius, what will happen if I make a patient apply a moisturizer? No, Chetna ji, they will skip sunscreen because nobody wants to have two layers. This layering of product is also depending on the weather you live in,
Correct. Mm.
right?
Mm.
So this has to be followed by a sunscreen. Now, sunscreen is a must. Now, sunscreen also has various types, like how we have different sizes in mall for everyone. Not all of us like a straight fit. We may like slim fit. We may like high waist, low waist. So, if you have a oily skin, you would like to go for a mattifying sunscreen. If you have a dry skin, you can go for lotion
Mm.
sunscreen.
Mm.
And if you feel I'm in between the two, or I'm very sensitive, there are certain sunscreens which come as an emulsion, aqua fluid.
Okay.
They are best suited for people who don't want to feel either too dry or too oily, right? SPF of 20 plus is also good for Indians. So it's not that you have to wear a 50, because if you wear a good sunscreen with, I'm sure Chetna ji, you're following that controversy regarding sunscreens that's going on. And I feel it is true, because if a sunscreen claims that you are having a 50 plus, any sunscreen for that matter, normally they will have a white cast.
Mm.
So not all Indians, especially men, I must say, they're not very comfortable wearing the sunscreen where it looks, I mean, maybe some of us also feel odd.
Yeah.
So 50 plus sunscreen becomes a limitation to wear. And what you can't wear every day, you can't really continue for long,
Yes. That.
right?
Yeah.
So any sunscreen, I prefer sometimes for slightly wheatish or darker skin tones, they can go for 30 SPF also.
Mm.
And if you are exposed to, whenever you go out, you're going out for a vacation or you go out for swimming, go for a 50 plus SPF, right? And as you remember, we always have talked that sunscreens are boyfriends or girlfriends. One can always change, but we need some partner in life,
Right,
right?
right. So you do a face wash with a not with soap definitely. Then you wait for some time and then apply the moisturizer or a cleanser, right? You do the cleanser and then do the moisturizer, but you wait and then you apply sunscreen. So then comes the compact and whatever they're using, right?
And sunscreen is also like a screen against pollution.
Okay, so you
And
can
the
use it.
product. Yes.
before the compact or after the compact if somebody is used to wearing all of those things. So now this is the pattern. Now this is how they should probably take care of the skin in the mornings when they're stepping out or whatever. So is there anything that they need to do just before sleep, or how many times a day can they wash their face? Some people
Right.
are used to, multiple times washing, thinking that that's how it'll be clean.
Absolutely. So one point that I must say, sunscreen is a very good primer. Most of these sunscreens are sweat resistant.
Hmm.
So, they will act as a very good primer for your makeup.
Okay.
But one should avoid, there's also one point. There are a lot of makeups that come with sunscreen, right? Understand that they can help you a bit, but they cannot replace your sunscreen.
Okay. Hmm.
So, and one point that I also think I should have mentioned is if you want to put a vitamin C, right? Mornings are a good time because vitamin C has the SPF of 15 in by itself.
Okay.
So, you do the vitamin C, or if you feel your skin is oily, you can go for a vitamin C in gel form or a serum form instead of a moisturizer before you put sunscreen.
Hmm. Hmm.
That was one point we I wanted to make. Second, you asked a question very pertinent that I say twice a week day is more than enough. The more you wash your face on the top, more your oil glands get a signal there is dryness above. So let me produce more oil. It has sebaceous hyperstimulation. So
Hmm.
one should wash face only twice. If you feel that it becomes too oily during the day, as we said, no, Chetna ji, it's very difficult for us to imagine outside Bangalore, but they can use a bit of blotting paper or a tissue. Washing it again will actually exacerbate the issue.
Okay, okay, okay. So, this
Yes.
question, there is this, doubt always in on people's mind whether facials are really good for skin. What is your take on this? And if it is good, then how many times a month can they do this?
See, facials are a very good way to pamper your skin. There is a lot of Chetna ji talk about how massages can more or less only work on your lymphatics.
Hmm.
See, let's imagine skin as a three-floor house, Chetna ji. The ground floor is your fat, right? And the first floor, collagen. And the dermis, where it has your collagen, which is like crisscross when we are born, and the upper floor, the top floor, that is your the dead skin layer, and the base of it, imagine the floor of the top floor has your melanin melanocytes which are producing pigment, and there are bricks in the top layer. So the topmost brick is where you put a cream, right? So when you do facials, it is with age. What happens? There's a popular notion that if you do facials, you don't age fast. But the fact is that with age, the ground floor will sink. Ironically, we gain weight, fat everywhere on the body, but it is the face where you do see a sinking of fat. So you'll
Hmm.
see women with our mothers and their friends, now they have bigger eyes, bigger sockets, and these folds come up. So this a facial at a parlor cannot help. The other layer above is collagen. Collagen doesn't grow with drinks also. Chetna ji, I mean, I'm sure you would ask me that
Yeah,
question
I
whether
had that
collagen
question on. Yeah.
added. So a lot of them, we feel collagen only grows when it is hurt or it is heated. So a medical grade procedure which helps in heating or boosting collagen will only boost collagen. The upper layers to some extent can be, so basically a parlor facial is a exfoliation treatment at the max. With a little face massage which boosts your lymphatics, you feel good. But using gua sha tools or massaging it up will not prevent sagging. So that is why you'll see a lot of dermatologists, they do medifacials now.
Hmm.
What we realized, there was a time when patients would come to us for treatment and they would go to a parlor for a facial. So doctors felt that why not we people, and it has started from the West rather. It has come to us late, where along with exfoliation, we people use devices like radio frequency around eye and around jaw to stimulate collagen, right? Or we use electric wands or electroporation devices to penetrate serums well. So if one feels like that I have to do something, right, then they may opt for dermatology medical grade facials, where doctors would put things which are more scientific.
And this is once a month, or how is it?
Yes. Yes. Now, the reason behind once a month, Chetna ji, is that skin approximately takes 28 days to shed 1 mm or so. So
Okay.
it's that's the reason it is placed a month apart. But nothing beats a good skincare routine. You
Okay.
see,
Okay.
it's
So
like nothing beats homemade food.
yeah, right. So that's when coming to food, that's another question which probably I'll ask you again when we talk about hair care as well. But one question that is here is, whether food really has any kind of impact on your skin at all. Like, how much of food taking intake matters when it comes to preventing aging of the skin. Does it really happen?
I mean, I'm sure we all have seen that our grandparents had luscious skin,
Yeah, true.
right? With no creams being applied. Sometimes, as a doctor, I feel we underemphasize the importance of eating good but eating less,
Hmm. True.
and a lot of physical activity. So there are examples in a home where parents haven't used anything, but they look far more younger.
Yeah.
So a diet which is going from, if you look down south, the diet is very, very scientific. I
Hmm.
mean, there is always a combination of carb and protein. Then there are those chutney podis and those rasam powders which enhance absorption of vitamin C,
Yeah.
right? I feel all over India we started eating like each other, which is not a good thing. You can't have, so go for low carb diet. It definitely delays aging. The more fiber you take in your diet, basically there is less oxidative stress to your body. One must understand that just like your other organs, if we get overweight, we get things like PCOD, pre-diabetes, eye problems, joint problems. Skin will also not be the same,
True.
right? So, less food, but good food.
Right.
More exercise, less sitting.
Right.
So if I tell you honestly, I feel food is the key to
Hmm.
whether it is skin and good hair care. We do need a little bit of those vitamin C, which we get in our podis, right? A lot of tamarind, lot of spices are used in a way that it enhances digestion. There's no constipation. And
Correct.
we all know constipation and gut issues also can cause acne and breakouts.
Hmm.
So one should be very traditional in food choices,
Right.
I feel.
Yeah. Yeah. Thank you, ma'am. I think we'll shift to hair care now. So, though there are multiple questions on skincare, I'm really short of time, unfortunately. So, shifting to hair care, first of all, I want to know, is there a difference between hair fall and hair loss?
Tanji, as always, your questions are intelligent, and hair fall is, you know what, one we I'm sure for the viewers we'll tell that hair is not a permanent organ, and it also has life cycles. It's one of those organs which keeps on growing, staying for a while, falling and regrowing.
Right.
So there are phases, for example, if somebody has gone through a fever like COVID, dengue, chikungunya, which is also on the rise, ironically. We
Hmm.
never heard of so many dengues when we were growing up, when we were actually playing on the roads,
Correct.
right?
Right.
But
Absolutely.
there is a rise in viral fevers, or there is, say, delivery of a child, sudden weight loss, or nutritional deficiency. There may be a lot of hair coming out in bunches from the root.
Hmm.
Most of these patients are actually what we call as telogen effluvium or hair shedding,
Okay.
right? Or hair fall.
Hmm.
But if it comes back, the for a patient, it is that the volume of the ponytail has gone down, but the hair grows long.
Hmm.
You know, patient will say it's growing long. I get a haircut also, but it's not as thick as I can't make a bun the
Hmm.
way I used to wear. So most of these patients are actually having hair fall, hair shedding.
Okay.
In hair loss, the regrowth of hair is less. So you'll see, widening of central parting, or there can be appearance of patches of baldness on the crown. That is hair loss. That means your new hair is not coming as long as your previous one,
Hmm.
and this can lead to permanent hair loss.
Okay, okay. So, does that have different patterns? This hair fall or hair loss especially, does it have like a different pattern?
Yes, ma'am, most of the patients, Chetna ji, who have shedding for very long time will complain of women especially, that this hair, this side, it's looking less.
Mm.
What they mistake it is that it is early baldness. It's not so. In men, baldness starts in the temples and crown. In females, the female pattern, there is only widening of central parting, what
Mm.
you call as a Christmas tree pattern,
Mm.
right?
Mm.
And in men, it can be vertex, it can be the frontal part, it can be both, right? Very rarely, even men can have a pattern which looks like women.
Okay.
That widening of center hairline is good, but the central part is missing. So
Mm.
there are various patterns of hair loss, but male pattern baldness generally presents with thinning in the crown and the sides. In
Okay.
women, if it is hair loss, they will have thinning in the central part, the parting that
Okay.
becomes white.
Okay, okay. So is normally what happens is when we talk about hair fall, the first thing everybody speaks about is the water that they're using. I mean, for of course, the what their intake and all that is something which rarely is discussed. The first thing they talk about is the water. Like they say when I came to Bangalore, there is hair loss, and when I go to Chennai, there is hair loss. So is that true?
Honestly, Chetna ji, I mean, I do feel sometimes even bad because Bangalore is a very wonderful city to live in. Ask us who live there. But I don't think water per se, washing hair with water, yes, hard water has more calcium, magnesium. So also, your hair frizziness may increase, your hair skin may be more dry because you require more shampoo and more soap to cleanse in a
Hmm.
hard water. And that's not in Bangalore, it's actually true for most of the major cities where people are more and resources will naturally be constrained,
Hmm.
right?
Hmm.
Because of that, indirect issues like split ends and dry hair, frizzy hair is more. But indirectly, if that water going in the fields and we're eating a vegetable which is rich in selenium, or there is a decrease in magnesium, that impacts hair. We don't have studies to corroborate it,
Okay.
right? In general, people also have a different lifestyle in big cities. We eat out more. We are sleeping at the time we want. You look at the amount of Swiggy, Zomato delivery boys on the road. So it's just convenient to blame the water for it, I feel.
Okay. So how much stress role does stress play in hair loss, especially hair fall?
No, but Chetna ji, absolutely stress definitely has a role because people do overeat when they're stressed out. They sleep less. That causes weight gain. There's also there are a lot of studies which say that if your cortisol is on the rise, it will also reduce the hair cycle, right?
Mm, mm,
So and it all boils down to metabolism and nutrition,
correct.
right? So for the India who slept early, for India who slept well, these issues barely existed.
Yeah,
Why?
absolutely.
They never had access to shampoos. I mean, we all remember our Ajis and Dodappas not using any shampoo all
Yeah.
their lives.
Yeah. Coming to shampoos and hair oil, serums, home remedies, there are like explosion of them online. I mean, you open a Insta post and just put hair care, you get like hundreds, thousands, millions, lakhs of them. So, in such a scenario, like that, first of all, does over-the-counter hair growth serums and all these oils, is it effective at all, or is it just a marketing hype?
I feel oils and shampoos have no role to play. As we discuss, if your shampoos are increasing your static electricity, you see less hair fall, right? If you put a conditioner, people are very scared to put conditioner when they're having hair shedding. The doctor, moment I put oil and conditioner, I see a lot of hair falling, right? So it's very difficult to pull out a hair from the root with the shampoo or oil, but what is fallen becomes more visible.
Mm.
So I don't think shampoo has much of role to play, right? Over the counter serums, we can't say if what they claim on the box is exactly the amount they put into it. So if somebody is experiencing hair shedding, till medical care is affordable in India, it's always good to go to a dermatologist. The only thing that you require in hair is very slow to grow. And what I often tell my junior colleagues also, patients also, it's very important to be very consistent. It's not like a one time treatment. You go to a doctor for cough, cold, and it gets better and you stop everything.
Mm-hmm.
So until the internal issues are solved, you have to be consistent with your treatment.
Okay, okay. Another big concern, I mean, doubt which people have these days is the hair color. Like they, everybody wants to color the hair. They don't want the hair to look gray. I mean, go gray first of all. So there is early graying that is happening. So, is first of all our hair colors okay to use, and is there anything that we need to watch out for? One more question. I know I'm adding in three questions here. The use of henna versus the use of hair colors. Three here. One is early graying, probably why some of the reasons for that. The second one is, are hair colors okay? If yes, then what are the things we need to watch out for? And henna versus hair color.
Actually a good question in the sense that early graying has become common. As I told you, we're eating more, but we see a lot of nutritional deficiencies. Now, whether there is a change in the soil quality or there's a food problem, but with nutritional deficiencies, graying has become more earlier. Also, decrease in sleep, increase in stress, right? It does affect, the stem cells, which are responsible for growing your hair and pigment. But the commonest thing that I see and we can objectively measure is nutritional deficiencies. Every second or third patient, if you do a test, they are low in some vitamin, some micronutrient, some iron, or so that's the reason we are seeing more graying. When it comes to coloring of hair, you cannot tell a patient avoid coloring. If you've grayed early, it may be a choice, a lifestyle choice rather. Your hair color doesn't damage your hair, right? Let it be sort of a revelation. There is a lot of negativity around hair coloring affecting your hair growth or causing hair fall. That's not true. If a hair oil is not impacting you, so doesn't a hair color. But there can be some impact visible on the face in sensitive skin patients. Like we do see some allergic rashes, and that doesn't happen immediately when you put a color, right? People, especially with thyroid and a tendency of autoimmunity, may present to doctor with a condition like LPP, like planus pigmentosus, which gets triggered with hair color, right? So if you have a sensitive skin, there are certain things in a hair color known as PPD, paraphenyl diamine, which we generally tell to avoid, right? But PPD free colors are 100% hypoallergenic. That is also not true, but they're better than a PPD containing color. So if you have a sensitive skin, you have a history of thyroid or eczemas, or you have had skin issues in the past, then you should ask your dermatologist to recommend you a PPD free color. And also, long term usage of dyes can sometimes cause pigmentation on the forehead.
Hmm.
So, that way, yes, it can be, but not in every patient who colors,
Okay.
right? So, when it comes to henna versus color, see, henna cannot turn your hair black. If your henna is making your hair color black, there is definitely addition of a dye to it. Honestly, Chetna ji, when you see a hair color, none of us see washing of color with shampooing, right? We what they call as root touch up. So your new hair is coming white.
Hmm.
That is the new hair.
Correct.
Most of them are permanent dyes.
Hmm.
So if you're sensitive to metal, right, artificial jewelry, you should avoid going for conventional color,
Okay.
right? You go for PPD free colors.
Okay.
That will prevent rashes. But on and whole, as I said, if it is pure henna, homegrown henna, nothing matches it. That is the only thing that is possibly chemical free. But then you have to be comfortable with that orange brown hue.
So does that actually cause a lot of dryness and frizziness? They say that, using of henna causes that.
I
Nothing.
don't think I personally feel no.
Okay. Okay.
No. Most of the people who are coloring also have something in the body which is also causing graying.
Yeah.
So if it's causing the color change, it will also cause a textural change.
Hmm.
But yes, a chemical put on a cuticle can definitely alter the properties of the hair. So we in general tell you to oil your hair, not your scalp. And you have to use a conditioner. In an Indian household, conditioner bottle finishes in the last.
True.
Most of us would skip it, right? The shampoo finishes fast, but conditioner lasts like for 6 months more. So make a habit of putting a conditioner on the hair whatsoever. You color, you don't color, you have frizzy hair or not, but have a habit of putting a conditioner on the hair for few minutes and then washing it off or using a leave-on conditioner. Because if you look at the advertisements, Chetna ji, this show a conditioner is going from the hair root to the entire hair. but there is actually no way that your these hairs are all grandfather father hair. They're
Yeah.
now grown. So
Yeah.
you have to moisturize them.
So, doctor, we just discussed about, oiling of the hair, how it should happen to the hair and not really the roots, because, we are used to, I think, uh, oiling the hair, leaving it overnight, and then washing it. So, could you just tell us whether what should actually be done when we look at oiling or moisturizing the hair, taking care of the hair?
Chetna, ji, we just talked that how your hair doesn't have any ammunition to protect it from the dryness of ACs and the heat, and how nothing from the scalp is going to nourish the hair body. So it's the hair body which actually, you can say, has a thirst for moisture. So oil your hair before head bath, a hour or two. Why I don't advise you sleeping with oiling even the hair overnight, not the scalp. Scalp is a big no-no. Is that, the same pillow you're going to put your face on it, right?
Hmm.
So that may actually call or cause something like comedones or oil acne. So
Okay.
always make a point that you don't do this practice of keeping it overnight, but an hour or two before the head bath. And would you be surprised to know that coconut oil is the only oil which can penetrate the cuticle of the hair?
Oh.
No matter how expensive oils comes on the shelf, our good old coconut oil is still beating the competition.
Mhm.
Right. So, of course, there are expensive oils like Moroccan oil, argan oil, and they also are good, but nothing still beats our good old coconut oil for your hair. So, you can oil the hair. Post wash, there has to be conditioner, or you get leave on conditioners that you should use. And always make sure that you put now shampoos are sulfate free. So that means that they are not, they should be used more regularly because they are not very effective cleansers. And in Indian is also Indian patient is not happy, be it whatever part of the country. Nobody wants to wash scalp often because there is a notion in our mind, be washing with chemicals will harm the hair and all that.
Mhm.
So minimum 3 to 4 times we say a week you should cleanse your scalp. Try to put more shampoo on the scalp rather than the hair.
Oh, okay. Okay. So 3 to 4 times is okay to do that because, like you
For
said,
women,
even I
yes, yes.
thought, only twice a week is something which we should probably do.
That is when, when we were younger, the shampoos actually had sulfates and they were very effective detergents. So, with water being hard, shampoo being sulfate free at least 3 to 4 times, scalp needs washing. And if you're a male patient, male person, you can even wash it every day. If you go to gym, you should wash it more often.
Okay.
So, scalp you wash and hair you moisturize.
Okay, great. I think that's a great line to remember as well. If I'm like we spoke about skincare, so is there something that we can actually do for our hair as well? Like, if you could talk about what are the kind of food that we should eat for our hair to be healthy, and what should our daily care be like, when you're talking about hair care?
So we always emphasize low carb and high fiber. Even on X, you'll see discussions about it. But your hair requires a lot of micronutrients. So all these dry fruits and seeds are a very good source. And foods which are rich in iron are very good for your hair growth. So if you're a non-vegetarian, it's actually got better iron than a vegetarian patient. So, chicken broth, depending on, again, I never give food as, because you just don't have to look at iron, you also have to look what is the status of your cholesterol or sugar. So it's always good to have a diet plan curated by a dietitian. But in general, iron rich foods, micronutrient rich foods, more protein in your diet, right? But eating only protein for hair is also not a right thing. I have patients who say, no doctor, I'll take a protein powder and hair will grow. It's not true. Hair also is like your food menu. You require everything to survive. We need carbs also in a bit. We also need healthy fats. So for the hair also, you need a good mix of it.
Okay.
And avoid eating any food that is going to compromise your metabolic health, because that will affect your hair a lot.
So all your
So
processed foods and your uh, deep fried foods and things like that, definitely not a good thing for your hair, right? Oh,
absolutely. Eating out every day, a burger a week, definitely will make your hair weak. So, like,
yeah.
one has to cut down on that.
Yeah. So what about there is, when you talk about oil, like you said, coconut oil is the best, but there are these oils like onion. I mean, they have these things like, right? They rub lemon, then lime, and then they use even onion. They probably make a juice out of it, and then they put it on your scalp for hair growth. So does that actually happen? Does it lead to hair growth, one, or does it actually nourish your hair?
Chetna ji, there's a condition known as alopecia areata, where it's an autoimmune condition. So earlier, onion oil was a grandmom's remedy. Basically, it would irritate the scalp, and in a condition like alopecia areata, irritation of scalp can bring back hair growth in those patches.
Oh.
So we have seen that working in alopecia when we used to see, in our college days. But other than that, it's not going to penetrate down into the scalp through the hair and give a hair growth,
Mm-hmm.
right? It's more or less a marketing gimmick. But when it comes to things like lime and curd, see, one must understand dandruff also is an alteration of skin pH. So whenever people will put lime and curd, they will see a temporary improvement
Mm-hmm.
on the scalp issues.
Okay.
The
Okay.
skin is an acidic pH. So somewhere there is some logic behind they've been there for so many years, right? So you
Right.
can't say it's completely baseless, or I always feel I think we are yet to discover what we used to do earlier, how much scientific it was. Certain practices like thinking castor oil is going to grow hair. If it's a male pattern baldness, no oil will have to grow hair. You'll have to go for a treatment. It's very difficult for patient to accept that home remedy will not help in certain conditions like female pattern baldness, male pattern baldness. There are times, Chetnaji, where it becomes when people come with progressive hair loss and we doctors tell them to do procedures. There's so much negativity around in media, and these procedures are, there are certain conditions where only procedures can bring back some amount of hair back, so they should consult a dermatologist. But lime and curd for a dandruff patient, possibly for the time they apply, may help. Onion, I am not so sure. In a general hair fall or a male pattern baldness, female hair loss, how would it help? It won't.
Okay, okay. Ma'am, coming to treatments per se, so first of all, when should someone consider getting a blood test done if, for their hair or skin health maybe? Like, is there something like, they should actually get their parameters checked? This is a condition.
As a doctor, I would say, why not every 6 months to 1 year? At least an annual checkup is mandatory for everyone. See, there was a time when India did not have access to affordable diagnostic tests. And we have also seen as medical students how expensive the tests were. Or we would have to stand in a queue in a medical college, waiting for a week for the reports to come. But since now there are affordable labs, and one must get an annual evaluation done. It's not for skin and hair. Skin and hair is actually going to tell us what's happening inside.
Hmm.
So at least annually once, you must get it done.
Okay.
All ages irrespective.
Okay. So, I have one question on whether our daily habits, like, wearing tight ponytails. Some people have this habit of pleating their hair and sleeping, when they braid their hair and sleep. And then, the use of wrong shampoos or over styling your hair. Does that actually silently worsen hair fall? Is there any such daily habit that we need to avoid?
But they don't worsen, Chetnaji, they don't worsen hair fall, but they can damage cuticle. So
Okay.
you'll have more split ends, and you'll have more issues like flies, if you're braiding too much. Or a very few patients can also have traction alopecia, where, if you see certain populations in the world, they have very tight hairstyles. And some places in Afro-American or African populations, they do very tight braiding once a week. Those things or practices are harmful. You want to use a dryer, you want to use a straightener, do it, but don't do it too often. Keep it at a distance from your hair. It may not impact hair loss or hair fall, but it does damage the hair body. So be gentle with your hair body, right? And be a little tough on cleansing part of your scalp. So you have to do ulta.
Okay. Okay.
We Indians are very gentle to the scalp, and we go braiding and making buns. So that can damage cuticle of the hair. Avoid that. Avoid using too many if you have to use a hair dryer, keep it at a distance, right?
Okay.
So other than that, it is always your daily eating, sleeping routine which actually impacts hair more.
Okay, okay. So now let's bust some popular myths with a quick true and false round. So I want you to tell me if it's true or false, whatever statements I'm asking you, and a small explanation on why it's true or why it's false. Okay.
Right.
So coming back to the lemon again, lemon plays a major role in Indian households on every, from skin, hair, everything. So the first question is, applying lemon directly on your face can permanently remove pigmentation.
False. It can rather cause rashes, and if you have sensitive skin, you may land up with the dermatologist. So
What about,
eat lemon,
sorry, go ahead, go
like
ahead.
eat lemon, drink lemon, right? But don't apply lemon directly on the skin.
Okay. What about aloe vera? Because that is something, homegrown aloe vera is something which a lot of people want to apply.
False, because we do see reactions to aloe vera. We do see small blackheads, comedones in certain patients who use aloe vera. So you want to go for aloe vera, go for a medical grade cosmetic which has aloe vera, which is pharmacologically derived. Only one part of it is good for skin, not the entire plant. So it can also trigger allergies.
Okay. You should scrub your face hard to remove blackheads.
False, it can increase pigmentation.
So scrubbing is not a good thing. Many people use rava, use sugar, use coffee powder, blah blah too.
No, no, no. They can go for a chemical exfoliant once a week. The dermatologist can prescribe. Let the medicine do the job. Don't use your hands. We see a lot of frictional melanosis in our part of the world because scrubbing is Indian way of feeling clean.
Right. So natural DIY masks like turmeric, curd, honey are always safe for all skin types.
Absolutely false. And it in a place like Bangalore where the weather is dry and skins are more sensitive, a big no. Right? They can eat all of them.
Okay, okay. Home remedies like baking soda for skin whitening are safe.
Absolutely false. They rather people gland up with sometimes second grade burns. So one should avoid them at all. Don't get misled into any claims.
Mm, okay. Shaving your head will make your hair grow back thicker.
Shaving, for the time being, your hairs are not growing. You'll see less hair falling because they are less visible, but it doesn't do anything to your hair root.
Okay. Okay. So,
It just makes the scalp cleansing better. So when you shave your hair, people feel there's less dandruff because it's very easy to wash your scalp.
mhm. So the treatments, for baldness, etc., are very harmful in nature. Is it harm?
Absolutely. No,
So
no.
what?
But you have to talk to your doctor, and doctors should ideally tell the pros and cons of it, right? So
Because
it should
these
be very
days,
transparent.
these days a lot of people are actually going in for those treatments, right? Because we didn't discuss in detail on early balding, like we discussed on early graying, but why is it why is that happening? Because it's become a big psychological issue as well. I'm sure it is something very very concerning for the person who's going through this, but they are going to alternate medicines. Recently we saw an incident where the entire village, I mean, people were left with blindness, like people went blind after using certain kind of person who came and promised a hair oil which would help them regrow the hair. So are you seeing a lot of baldness in your people coming in with that issue?
I'm absolutely. There's a lot of, and I told you, because of bad metabolism, we are seeing a preponement of male pattern baldness, which was more common in 45 plus, is now becoming common in early 20s. And it requires a medical grade treatment. And often it's not the treatment that fails a patient. Patients are inconsistent with treatment.
Okay.
Because it's very difficult to knock this problem, notion out of a patient that for a hair treatment, you have to be very consistent. Till the time you will do those treatments, hair would last only then. If you're having male pattern baldness, there is no treatment that's going to last you forever. So
Mm.
patients give up because I want something permanent, right? And as Indians are getting more impatient, With each passing year, you see this behavior more.
So, what
But
are some of
hair,
the advanced treatments regarding this? Are there any advanced treatments that have come?
a lot, rather, most of the hair treatments like platelet rich plasma, growth factor concentrate, they are derived from your own blood. So your blood has platelets which have more than 100 growth factors. So more and more the world is going towards regenerative medicine. Regenerative medicine is using your own body's growth factors to grow hair, right? Of course, they can be done by a qualified dermatologist, and they are safe because they derive from your own blood. There are also procedures like mesotherapies, there is exosomes coming. So the world is advancing. We are still behind the rest of the world in exosomes. Exosomes are like those signaling molecules, which body uses to communicate with each other. So we are getting more specific that instead of giving all platelet rich plasma, we were moving towards exosomes. We are moving towards stromal cell fraction, where we take a piece of skin. So we say the in microenvironment of hair around the hair promotes hair growth. So there are some devices which take that out and we inject it with micro inject or micro needle it into your scalp. So there are some treatments. See, none of them in hair works like in toto
Mm.
approach that do this and you grow hair. They are always done in combination. But some of them are very, very safe. Very, very safe.
Okay. So when you talk about, I know there are a lot more questions, but I think I'll restrict it to two more. One is, a lot of these days we hear a lot of kidney issues with the use of makeup products and with the use of ointments and skin fairness creams and those things. So there have been papers published as well regarding this, that use of these medicines can mercury, especially the presence of mercury in these medicines, can actually damage your kidneys. So how much of that is true?
I feel that these things cannot be completely baseless. So most of the OTC products which claim to make people fairer and lovelier and more handsome could have had those contaminants. That is why we insist on pharmacologic derived products, because the drug companies have a lot to lose if they do, compared to a brand which is over the counter. But I also feel, at the other hand, a lot of exposure over years is required for something to penetrate from your skin and cause long term kidney damage. Now, how much those studies took those things in account, very difficult to comment.
Right.
But rare that, because it's very difficult to make skin absorb. Skin is a very robust barrier. If skin could absorb, we would never have had injections, right? We struggle to make skin. We use rollers and microneedle and derma pens to make vitamins penetrate into the skin.
Right, right. Yeah. So, a lot of people ask whenever we go to a dermatologist, usually we kind of tend to ask them that, is there any golden rule that I need to follow, which I can, consistently do and then keep my skin and hair healthy? So, any such golden rule, does it exist? If yes, what is it?
Um, Chetna ji, I'm going to say eat well, sleep well, eat less, move more, right? Use good products for your scalp cleansing. Always use anti-dandruff shampoo at least once a week. Keep your scalp health good, and make sure you condition your hair and you oil your hair. For skin, never skip a sunscreen, never over exfoliate, never over wash.
Okay, thank you very much, Dr. Divya. It was wonderful speaking to you. Always, I mean, it's always a pleasure because so much of knowledge, it's very rare that we, get to hear from doctors. They're kind of hesitant to either share it or they're kind of directing you to a different kind of things all the time. But very rare that we get people like you to come on our show and give us so much knowledge. Thank you very much. It was wonderful speaking to you.
It's pleasure. Likewise, likewise.
Thank you, Doctor.
Thank you.